Hello, everybody, and welcome to our How To Corner. In today's episode, we're going to talk about the ruptured Achilles and the peculiar cases of Damian Lillard and Jason Tatum's injury. I'm Dr. Will Gray. Before we get started today, please like, share, subscribe, and join the movement and comment. If you have anything that you want us to talk about or anything that you listen to that you enjoy, please comment, man, and we'll try to make some content for you all. And with that being said, let's move into the episode. In today's episode, we're going to cover three aspects of the Achilles. We're going to talk about what is an Achilles, how does an Achilles injury occur, and how long does it take to recover. I think these are the three main pieces of an Achilles injury, in the sense of just making sure that we cover our bases. Okay. Now let's talk about the Achilles itself in the form of the anatomy. Where is it? How is it made up? So for everybody who's been on Mars for the past day or so, the Achilles tendon is a part of your calf muscle, and it originates as a piece of tendon that connects your gastrocnemius and your soleus to your heel or your calcaneus. Okay. Now, this tendon is very powerful, plays a role in everything you do: walk, run, jump, sprint, you know, even when you cut and all that stuff, when you're trying to plant. And then basically, without it, you couldn't do any of the things I just said, right? But that's the Achilles tendon, what it is, where it's located, what it does, right? Now, the next thing is the injury, right? The Achilles tendon rupture, right, is mostly a thing that occurs during a sport or physical activity. There are some situations where you can just step off the side of a sidewalk, walk down the steps, get out your truck, make a wrong move outside in the yard, cutting the grass, and bam, there you go, right? But with that, for the most part, that tendon tears in that way, okay? Now, this peculiar tendon and this peculiar injury, because they're very weird in my opinion, because it's kind of hard to explain when it's going to tear, but when it tears, right? It can tear in three places. It can tear in the muscle belly part right before it becomes tendinous. It can tear in the middle of the tendon, and it can tear it from the bone, right, off the heel. Now, somebody's probably asking me, which one would you rather have, right? It's kind of argument here. Some people rather for it to come off the bone at the insertion point because they can just pull it back down, screw it together, anchor it in, put some growth hormone down there, bam, wham, bam, thank you, man, we back rolling. Some people will say in the muscle belly because it had a lot more blood circulation to it, so they can heal back. But for the most part, that's really just a conversation that you can have back and forth about the Achilles tendon, where you would want it to tear at. This specific injury is very common in us males between age 30 and 50. Just because we get a little out of shape, get a little older, you start to lose water in your muscles and your tendons so they don't stretch as well. And then as a result of that, getting a little older, getting a little more weight, not being as active, you're doing activities, doing things you probably thought you could do back, younger. Now you're older, you're trying to go back and live. And you realize that, wow, I'm older, my body doesn't respond the same, and now you have an injury. Now the signs and symptoms of injury are pretty obvious in the sense of when you think about how does it happen, and like I talked about on the last slide, just sudden forceful contraction of those muscles or that area when you're trying to plant. There's a weakness there. There's some tendonitis there, some constant discomfort there over the extended period of time that starts to degrade the tendon a little bit. And then you fall in a certain age group that's more susceptible to a tear. So signs and symptoms, right? Sudden sharp pain in the back of the ankle, felt like somebody came up and kicked you. You'll hear pop sometimes, and then you have difficulty walking or pushing off. Now, the physical examination that we do as physical therapists, we'll look at the actual calf and heel area to determine if there's any swelling, bruising that has occurred. We'll look at a palpable gap in the tendon, right? And basically, what we're looking for is a divot. And with that, we'll do what we call a Thompson test, where we'll lie you down and on your stomach, and we'll squeeze your calf, and your toe will not point down, and as a result, your tendon is gone. Right? Those are things we do, and those are some symptoms that you can be aware of if it happens to you or a friend or somebody you know to be able to help them to get to where they need to get going in order to be evaluated further. Now, let's talk about the management, right? I've seen people recover from this injury, depending on the severity of the injury, depending on the location of the injury. They're not off the bone, but it's in the muscle part without rehabilitation or surgery. I would not tell them to do the thing they were doing when they initially torn it because the muscle is probably nowhere healed, but it's not torn apart, so you can walk around, you can lift probably, but you're not hooping, right? Now, that's non-surgical, and that consists of functional brace and early mobilization reserved for less active patient and partial tears. Like I just said, you can't resume what you were doing. You probably want to bring down your activity. You're probably going to be there for a while. It's just very hard to go back if you don't have some type of intervention past a non-surgical intervention, depending on the location of the tear. Now, with the surgical paracel, which I've seen this surgery multiple times, many times, they get the tendon. If it's torn apart, they try to suture it back together in that mid substance area. If it's off the bone, man, they just pull it back down, anchor it down with a nice, pretty screw. Make sure they get it right with length tension relationship. You know, all those fancy approaches to make sure that it's the right length when it's attached back to the bone. And then after that, man, the active individual reduce re-rupture risk, right? Because if you have the surgical procedure, you're trying to prevent re-rupture. Non-surgical, a little bit of gray area there. But this surgical repair is pretty much just like that. You know, I made it a lot simpler than what it is, but for the most part, put the tendon back together, make sure it's nice and good, look at it, assess it. Now we move on to the part where I love. The rehab, okay. I'm not going to bore you, okay? This rehab is long, okay? Takes time. You're not going to be full weight bearing in about 3 months, right? If you start to jog, it will be anti-gravity or gravity reduced or in a pool, right? And athletes may return to play at a pre-injury level, though some report diminished performance. Woo! There goes the elephant in the room. When you have this injury, man, since that tendon is important for producing that push off of that explosion, some people lose a step, you know, and some people don't. Maybe they don't depend on that. But that soleus gastride complex, trying to strengthen that up, being off of it for 12 weeks, that atrophy that sets in, the inhibition that you have from a mental standpoint, trying to perform, really limits your ability to be able to get all the way back. And there goes that grunt you have when you see Jason Tatum and Damian Lillard on the ground grabbing at the lower part of their leg. Most likely, they were dealing with some level of Achilles discomfort prior to the injury. They probably had some tendonitis going on. Calf was probably a little bit strained. My favorite injury to see on the actual ticker when I'm watching, you know, ESPN or any basketball game, calf strain. Why? That's their way of saying, don't look at us. It's probably an Achilles issue. We're going to call it a calf strain because we don't want to cause any caution. Or my bad, they want to cause any panic. But for the most part, man, in these guys' situations, if you watch how it happened, Jason Tatum was going for a loose ball that Jaylen Brown turned over. Goodness, he was turning the ball over that series. And he takes a step, wham, bam, thank you, ma'am, on the ground. Damian Lillard, it was even more, you know, inconspicuous. You look up, he's on the ground. Like, and that just goes to show you, like, you don't have to be doing a bunch for it to occur. It can just happen. But in their situation, I can almost guarantee you, that they had some discomfort going before this. And they were just playing through it because, like I said, man, it's one of those injuries or issues where you can't really put your finger on when it's going to go. But there's signs that they kind of let you know that, hey, man, you may want to kind of figure this thing out. Try to do your best to strengthen the muscles that are attached to it, to offload that tendon a little bit, possibly. Um, you know, different things, man. But I feel for those two guys, and I'm really hoping that those two guys get an opportunity to be able to come back better than ever and stronger than ever. But always keep in mind that when you have this injury and you're trying to recover and you're trying to get to the next place after this injury, it's a long road, but it's not the end of the road. And with that being said, thank you everybody for making it to this point in the talk. Like, share, and subscribe. Contact us 3gn.com/booking. And if you have any questions or concerns, man, you can also DM us immediately, and we'll try to get back to you as quick as we can. And with that being said, I hope you have a blessed one. I'll catch you in the next one.